Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to personally welcome you to episode, wait for it, 309 of the Ask Dr. Angela podcast. So I'm sure you probably noticed, damn, she's got another guest on the show. Yes, I am doing more guest features because it's fun to talk to other people, and, I think that people bring a lot to the show. I mean, I bring a whole lot, but it's really nice to kind of share the spotlight with folks that have really good information. So today we are talking about incontinence. And what is incontinence? Oh my gosh, it's, loss of bladder control. More simply put, it's like when you can't control your bladder and you're leaking urine and it's embarrassing and nobody's talking about it because everybody thinks that it's just them, and that's so not true because I see women really on a daily basis that deal with this. And it's not just old women. Everyone thinks that this is something that just affects, senior people, but this affects young people as well, moms, that are in their 20s, 30s, etc. So it's not just something that affects one particular, segment of the population. Incontinence is something that can affect us all. So I'm really, 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 really thrilled to have on the show today Mary Ellen. Mary Ellen is I'm going to let her tell the story of how our paths crossed, but Mary Ellen Reeder is the co-founder of a product called Yarlap. And Mary Ellen, welcome to the show. Tell the listeners how we came to connect. I think it's a really good story.
Well, thank you so much. So we actually connected because of Nick Gillespie, didn't we? At Reason. And
I have no idea who
how
Nick
great
Gillespie
you
is.
were with talking about the orgasm. There was this symposium conference that you were talking about female empowerment, sexual empowerment, and we actually connected that way because the pelvic floor is all connected to not only your bladder control but your sexual pleasure, and our paths kind of crossed on that women's health total alignment area.
So the interesting thing about Mary Ellen that you also need to know is everyone knows that I'm from Ohio. I'm a Midwesterner. I'm a Buckeye. And Mary Ellen, actually, I think one time I was talking to you, and weren't you at my favorite Starbucks in Cincinnati? You were
yes.
Yes, I know. And you were in Rookwood Pavilion. And then we were talking about Buskin Bakery, which is the best bakery in the world. And so I liked you immediately just based on the fact that you were kind of like a homegirl and you were kind of doing your thing. And you actually came to me as a young woman that wanted to talk about this topic that nobody's talking about, incontinence. So before I delve into the whole incontinence thing, how is it that incontinence piqued your curiosity, so to speak?
So my dad is actually a medical device engineer, and I worked with the National Democratic Institute for female voting, and then transferred over to Women for Women International, helping them with basic women's rights, and that tapped into women's health. And I really kind of focused in on when women know about their bodies and they can kind of help better themselves, all of a sudden society kind of is better. And it's a weird link. So I was really into women's health and all those other things. And my dad had the Yarlap and got it FDA cleared. And he looked at me, he was like, "This is right up your alley." I looked at him and I said, "This is perfect for me, but incontinence only deals with old people. I don't really know if that's my vibe." And he goes, No, it's way more than that. Just look into it. And so I started talking to all my girlfriends, and I was like, does anybody know about this? Like, it's just for old people, right? And I kid you not, I was with my friends. Two of them looked me dead in the eye, and they're like, wait, I have that. And I'm talking like girls who are 25 years old looking at me dead in the eye thinking, oh my God, wait, I thought that I was the only one who had this problem. And I talked to like some of my coworkers, and they're like, wait, now I have this. This is like my biggest fear after I have my baby. What's going on?
Mm-hmm.
And all of a sudden I'm realizing there's like this huge, like quiet conversation that's not being had. And nobody knows how to talk about it because it's really embarrassing.
I know.
And I was like, wait, this is perfect for me. I love this.
I know. So it's like so funny that you mentioned that. Like nobody is talking about it. And why? Because people are embarrassed. Everyone thinks that they're like the only one. And what's really interesting, and I see tons of women every day, all the time. And, they're like, oh my gosh, Dr. Angela. And I'm like, just put it out there. What's going on? And they're like, I like wear a liner because I'm leaking, my bladder, I don't have any control. And, they're like, I'm just embarrassed to tell you this. And I'm like, so I'm just going to tell you that on a daily basis, I see at least 5 people that are dealing with this. What I really want to say is, girl, I just saw like 3 of your girlfriends and they all have the same thing. So one of the things that I sometimes actually challenge patients to do because they think that they're the only ones. And obviously I can't say I just saw 5 of your girlfriends because that's a huge HIPAA violation. So I can't do that. But what I do urge people to do is I'm like, you know what? I tell you what, the next time that you are out to lunch, out for drinks with your crew, I dare you to just, take a shot and then ask them who in here, kind of loses a little bit of pee when they cough, when they laugh. And I guarantee you, somebody else at that table is going to raise their hand. Multiple people will raise their hand. So I'm really happy to have you here to kind of like destigmatize this because this, as you said, it's not just affecting old folks and it's a lot more common than you think. So let's just break this down a little bit. Incontinence, it's losing urine when you don't want to lose urine. It's like loss of bladder control. What people don't realize is that there are different kinds of incontinence. There's stress incontinence, urge incontinence, overflow incontinence, functional, mixed incontinence. Just very briefly, stress incontinence is when you lose or leak urine with a stress, whether it's a cough, a laugh, lifting heavy objects. That's stress incontinence. Oh my gosh, I was jumping on the trampoline with my kid and I was like leaking. That's stress incontinence. Urge incontinence is when all of a sudden, you've seen those commercials, gotta go, just out of the blue, boom, it hits you, you gotta go to the bathroom. It's more common than you think. And these are probably stress and urge incontinence are the 2 types of incontinence that I encounter predominantly. Overflow incontinence is when you have frequent or constant dribbling of urine. And that's due to the bladder not completely emptying. So a common question that I ask patients all the time is when you pee, do you feel like you've completely emptied your bladder? And sometimes the answer to that is no. So people with overflow incontinence, they have a lot of frequent or constant dribbling of urine. And then there's functional incontinence, which no one ever talks about. And that's just, some kind of physical or mental impairment that keeps you from making it to the bathroom in time. People that have things like severe arthritis might not be able to unzip or unbutton their pants because their joints just aren't functioning the right way. And then last but not least, mixed incontinence is when you have more than one type of incontinence. And, oh my gosh, is this normal? It might be, but my general rule of thumb is anytime that you have a condition and, stress incontinence, I always tell people it's not a disease, but it's a symptom. But anytime you have something that's interfering with your quality of life, like, oh my gosh, I can't go out with my girls or my friends. I can't go to work because I'm afraid that I'm going to pee my pants or I'm leaking all the time and it's just an inconvenience. I don't want to keep having to go to the bathroom. Anytime that that's happening to you, then you need to do something about it. It's kind of how I feel about it. So let me ask you this, Mary Ellen, and certainly, you said that you have a lot of girlfriends that deal with incontinence. What have they done about it? Or have they done anything about it?
Yeah, I think that a lot of the time, one, a lot of my younger friends, like girls who are my age, they kind of have this mentality where it's like, oh, well, this is just, I guess, part of who I am, and this is just how I'm going to be. And I think that that's really false. And it's kind of sad because, like you just said, it is treatable. You just kind of have to take a proactive stance to fix it.
Mm-hmm.
A lot of my friends, they'll also use panty liners. They'll use period pads or tampons.
Mm-hmm.
Just because I think that there's a lot less stigma buying menstruation products than there are buying, bladder incontinence products. So they'll go out and they'll get like a massive box of tampons, and they'll go through it, so many boxes a month because they're using it not just on their period, but they're using it for bladder leaks.
Right.
Not a lot of the people that I know wear diapers. I know a lot of the runners, though, who do, especially when they're doing a big event. They're like, well, I don't have time to stop at the bathroom. It'll hurt my time, so I'm just going to wear this diaper. And they'll do that. Some people go and they take the medication, and there's a lot of different medications because there's a wide variety of incontinence. But some people have not so great side effects of them. And then you have the surgery, which I think we've all seen on television, the Sling Surgery.
That's funny.
That one.
That's funny because I'm actually going to stand up for my urogynecology friends. I have a lot of patients that and people that get the Sling surgery, those are typically people that have stress incontinence. That's a weakening of the neck of the bladder, and so certainly the reason for the sling is to help support that. I'm not going to weigh in on that completely because that's like a whole nother topic. But, in the right candidate, people can do very well with that. But since we are talking about, treatments and all that kinds of stuff, let's talk about, so you do go to your doctor and you say, oh my gosh, this is going on. One of the things that's really important is getting a really thorough history. And so, I always start with less being more. You don't want to jump right to invasive things. But, with regards to things that can cause incontinence, sometimes, depending on the type of incontinence, which is another reason to see your doctor so that we can better define, number one, what type of incontinence. Number two, if you have more than one type of incontinence. And number three, based on that discovery, how to treat it. But sometimes it's as simple as, dietary modification. People don't realize that, certain things that they drink or that they eat or even certain medications can lead to incontinence, alcohol, caffeine, sodas, artificial sweeteners, chocolate. Most of those things that I just mentioned have caffeine in it. Chili peppers, foods that are very spicy, certain blood pressure medications, typically diuretics, are going to make you go to the bathroom a lot more. So those are all things to kind of, think about. And then with regards to things that might cause incontinence on a more persistent basis, things like pregnancy. Hello, you've got like a growing fetus that's like tap dancing on your bladder. Of course, you're going to have to go to the bathroom more often. And with regards to childbirth, I think that kind of a myth that people have is, oh my gosh, I had a vaginal delivery. I'm going to be the only one that's affected with incontinence. People that have C-sections don't have incontinence. That's completely false. I know tons of women that have had sections or C-sections, if you will, that also deal with incontinence kinds of things. Certainly, things like menopause, where you have less estrogen production, that also can lead to things as regards to incontinence, because what people don't realize is that that estrogen actually helps to maintain the lining of the bladder and urethra. So once you enter menopause, bladder and urethra become much weaker. So those are kind of, some obvious causes of incontinence. But with regards to how you work that up and treat it, I think it's really important for you to, number one, not to be afraid to have the conversations. And if you are someone that's as informed as you are, Mary Ellen, getting the information out and, telling your friends, you probably should get that worked out, because women, on the whole, we always think that this is how our life is supposed to be. Oh, that's just part of being a woman. No, that is not just part of being a woman. If this is something that is really affecting your quality of life or your ability to do what you need to do, then you need to have that worked up by your doctor. Other things, age, yes, when you get old, you can get this, but young people get this as well. Being overweight can affect continence. Smoking can affect continence. I mean, there's a whole list of things that can affect continence. So, what I'm going to tell the listeners is this is the reason that you need to see your doctor, so that you can take a very thorough history. You can eliminate those things that might be in your history that are contributing to that. And then you certainly can try some more conservative things, whether it's dietary modification, whether it's, losing weight, whether it's, cutting back on the drinking, doing things like fluid intake monitoring, perhaps not having that glass of water at 8:00 at night before you go to bed. Certainly doing things like Kegel exercises, which for the record, don't work overnight. It takes I tell folks, 8 to 12 weeks before you're going to see a benefit in that. And if you don't know how to do a Kegel, the best way for me to explain that is for you, the next time you go pee, try to stop your urine midstream. That's the squeeze that you want. I recommend typically 5 sets of 10. And don't give me that, oh my gosh, I don't have time. I'm like sitting here doing Kegels right now in a room with 2 guys and nobody knew what I was doing. Okay, so I know my guy Ming and his intern Nick are like sitting here looking at me like, what? But anyway, these are options. So Mary Ellen, what I really want you to do right now is I do want to give you an opportunity to talk about, the technology that you and your dad have. Because again, this is about giving women information and exposure. And I will give you an opportunity also to direct people to your website so that they can learn more about what this is that you came up with. And I really also want you to speak to, your experience with this equipment. Go for it.
Yeah. Well, it's so funny because I was just at a baby shower a few months ago. And I kid you not, every single time I go somewhere, somebody always mentions that it's a really weird misconception, but they're like, Mary Ellen messed up with vaginas. And that always sparks everybody's interest. And then it finally goes down to what I actually do, which is, pelvic floor rehabilitation.
Right.
And I kid you not, every other mom, every other woman that was at that baby shower was just coming up to me and they're like, wait, I have this problem. Are you telling me? And then they were looking at each other. I'm like, you are family members. You guys should be talking about this. Why is this a new topic for this family to be talking about? And some of them were sisters with each other, and they're like, wait,
I know.
Is that why every single time that you're laughing, you're crossing your legs? I was like, yes, it is. Talk about it. Talk about it with each other. You are not alone. You are never alone in this. You always know somebody who's got it. And so that's kind of how I got into with the Yarlap. I actually had a separate issue personally. My pelvic floor was really tight, so whenever I would go to the bathroom, I would stand up and I would still pee a little bit because it would come dribbling out. And, that led to a lot of other things that's painful, the whole 9 yards. Hopefully my family members will listen to this and be like, oh, we learned a lot more about Mary Ellen than we ever needed to. But that's kind of how we came up with the Yarlap is my dad worked with the team in Europe for the national healthcare systems over there for Germany, France, Great Britain, who all have the postpartum perineal reeducation. They give a device kind of like the Yarlap to postpartum women after their first checkup when they're able and cleared for exercise to tone the pelvic floor because it's good to have that. You can prevent a lot of issues like incontinence when you help a mom out. And in the U.S., we have a few things like that, but nothing readily over the counter available. So that's where the Yarlap kind of came in. And the Yarlap's a bit different because the technology not only teaches you how to do Kegels and sends a signal directly into your muscle to do it for you, but it also teaches your pelvic floor muscles to relax. So the key thing there for and you know this, but it's for like everybody else, is that for the total pelvic floor muscle control, you want to be able to clench on command, but also relax. And so that's kind of what the ER-Lap is designed to do, is to give that all in one package to you. And you don't have to think about it, because it's easy to do the Kegels when you're doing them correctly. The thing is like a lot of people don't know how to do them. It's not something that we're taught in school. I think that would be a really weird thing to talk about in school, is teach everybody how to do Kegels. But it's really important to do, and you should be doing them all the time to help kind of maintain that pelvic floor muscle tone, but also bladder control. But if you don't have that tone, or you don't know how to do it properly, the ER-Lap kind of teaches you how to do it and does it all for you. So that's how we came to be. That's what we do.
Oh, so do this. Do me a huge favor. Tell people where they can visit you, throw your website out there so that the listeners, if they want to learn more about ER-Lap, they can, visit you and at your website and get more information on it.
Yeah, so we are available at yarlap.com, YARLAP.com, and we're also on Amazon as well. And depending on who you ask, sometimes people who leave Amazon reviews, I'm sure you're aware of this, are a lot more open. There's a lot of fun reviews if you would like to read those. But it's just crazy how when people get really excited, they tell you everything, and it's fantastic. So if you want to reach out to me, yarlap.com is the best way to go. And I love talking to people. So if anybody has any questions or anything like that, I'm happy to answer them.
Mary Ellen, thank you so much for being a guest on the podcast. It took way too long for me to make this happen, but I'm so happy that we finally did. I hope that you all learned a lot. I certainly did. I do know a lot about incontinence, but you can learn something from everyone. So thank you again. To all of the listeners.
Thank you so much.
Yes. To all of my listeners, thank you so much for tuning in. You know how to reach me, www.askdrangela.com. That's AskDrangela.com. You can hit me up on any of my social media channels. That's Twitter, Facebook, Instagram. I have a YouTube channel as well. I always leave you with something, and I'm going to leave you with something else from my favorite Life's Little Instruction book. This is lesson 438. It says, every person that you meet knows something you don't. Learn from them. I like that. I'm going to say that again. Every person that you meet knows something that you don't. Learn from them. So, Mary Ellen, I learned a lot from you today. Thank you so much. In closing, I'm going to tell you, my listeners, I cannot wait to reconnect on episode 310 of the Ask Dr. Angela podcast. Until then, look better, feel better, be better.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.